Today we're going to talk about how to set up a water seal chest drain for babies that have a chest tube. Also, you can just put on a Heimlich valve. Most of these kids will not be kept here at Valley View. A Heimlich valve is something they use for transport because they cannot use a chest tube. But if it's going to be a while before a baby is going to be able to get transported, a water seal chamber drain is best for the baby. You will need to get out your water seal chamber drain, which is kept in your core cart in the bottom drawer. You will also need to get some sterile water. You can get the sterile water in the Omnicell in the Pyxis, which is by the feeding supplies. This is not a sterile procedure, but you do want to keep it as clean as possible. This looks intimidating, but it is not. There are instructions that are easy to follow if you don't remember how to do this, which I'm sure you won't. So in the back of your water seal drainage system, there is this funnel looking device. This is step one. You take your funnel device and you get a bottle of sterile water. What we're filling is the water seal chamber. So come real close. What we want is we want the water to go to this 2 centimeter marking. So I'm going to take the bottle of water with my funnel, and you'll notice the water will change blue so that you can see how much you're putting in. It takes approximately 30 milliliters to get it up to that dotted line, which is where you want it set. That's step one. Step two is we want to fill up our suction control chamber. This is what controls the suction of the baby, or how much suction the baby will get. On top of the water seal drainage is a gray vent or plug. You remove the gray plug and you simply dump in water until the prescribed amount. Again, the water will turn blue. Generally, the degree of suction that a baby is written for is generally between 10 to 15 milliliters. Again, it takes approximately 120 milliliters of water. I'm just dumping it in. And for the purpose of this demonstration, we'll fill till the 10 centimeter mark. That's truly as easy as it is to set up the drainage system of the chest tube. I put the gray plug back in here. Now we need to set this up for the baby. On the back of your suction control device, there are 2 adapters if needed, because sometimes the chest tubes do not always fit on here. They won't fit on here. So you have to choose whichever device fits the chest drain. So for instance, I'm going to put this one on here, and this would hook directly to the chest tube. Each chest tube drainage system has hooks. You want it below the level of the baby, so in every warmer there are hooks. This again goes, the long tubing goes to the chest tube. The short tubing that we put has the funnel connected to it. You're going to disconnect the funnel and you're going to attach it to wall suction. Then we're going to turn our wall suction on, and you're going to notice this. When you turn the suction on, what you want is just a gentle bubble. You don't want vigorous bubbling like that. You want just a gentle control of suction. What you need to watch for when you have a baby that has an air leak is this chamber here tells you if you have an air leak still. If you have a air leak, you'll see a gentle blurb of an air bubble. That means you still have an air leak. However, if you get something that looks like that means somewhere you have disconnected. Either your chest tube has fallen out or your chest tube has come apart from, there's a disconnect with your suction or something. You should only see a gentle blurb of air. This fluid level will fluctuate with breaths. That is normal.